hard to get everybody on board with that. All right, number 14. Which of the following methods of disinfection and sterilization, which of the following will kill all organisms, including all bacterial spores? Pasteurization, orthophthalealdehyde, steam sterilization, or ethylene oxide. I'm sorry for butchering these words. Oh, another interesting thing is one facility checks all EB cultures, which is amazing. That's another area of definite need in Washington State that we've identified. I was just at an antimicrobial stewardship meeting before this, so sorry that I always go into depth on these AMS, ASP questions. Okay, so definitely a big mix here. 50% for 3 and 4, but we have responses for all of the others also. Correct response is 3 and 4, steam sterilization and ethylene oxide. I believe we have a slide on this. If not, I will read off. Okay, so steam sterilization, a little bit about that is it kills bacterial spores and all other microorganisms. However, it can only be used for items that are tolerant of high temperatures. Ethylene oxide is a gas sterilization, is a low heat method for items that they're not heat tolerant to that steam sterilization, but they must be allowed time for aeration prior to use, so a little more time intensive. Number 15, hydrogen peroxide vapor has been shown to be effective for decontamination of patient rooms and is known to kill spores for other microbes. Despite the benefits, there are some drawbacks to using HPV. Funny to say it that way. All right. Which of the following could be a major drawback to using HPV to clean patient rooms? It is effective in decontaminating surfaces, but not equipment. It leaves a residue that, over time, can damage equipment in the room. It lengthens room turnover because it takes a prolonged period of time to complete room treatment. Or it is most effective for areas closer to the unit and less effective around the edges of the room. I'll give you guys to read through that again. That's a pretty long, wordy one. All right. Between C and D. And C is the correct response. It lengthens room turnover because it takes a prolonged period of time to complete room treatment. See if we have something else about this. So pros and cons of HPV. The pros are it decreases incidence of C. difficile infection. It's effective on surfaces and equipment throughout the room. The cons that it cannot be utilized while the patient's in the room. It lasts a long period of time. It can be challenging to use for daily cleaning, and it delays room turnover. So, or could potentially, which is definitely an issue. You know, you're always looking at the time before you can get somebody else in your room. So it's something to consider with this. Oh, must have gone out of order. All right. So while making rounds in one of the intensive care units, the IP observes a patient who has just been intubated is on a ventilator. He notes that the patient is in a supine position. Which of the following positions should he recommend to the nurse in order to be compliant with a pneumonia prevention bundle? The patient should be turned to his side to facilitate drainage of secretions. The patient should be placed in reverse Trendelenburg position. The patient head of bed should be elevated to an angle of 30 to 45 degrees, or the patient should sit upright at a 60 to 75 degree angle. All right, you guys, put all your answers in before I even finished it. That's good. On it. All right, so the correct answer is C. The patient's head of bed should be elevated to an angle of 30 to 45 degrees. There's where our slides were out of order. Other things that should be in your VAP bundle would be elevation of the head of bed, daily sedative interruption, and assessment of readiness to extubate. The test can be a little tricky, just with things like daily, weekly, so that's something to notice. One of those trigger words to look at. Peptic ulcer disease prophylaxis, DVT prophylaxis, daily oral care with chlorhexidine. Number 17. A patient with bacterial meningitis due to Neisseria meningitidis requires what type of transmission-based precautions? Contact, standard, droplet, or airborne? Mostly C's and D's here, droplet precautions or airborne, and the correct response is C, droplet precautions. Number 18. Which federal agencies in the United States have published regulations pertaining to infection and medical or regulated waste? U.S. Environmental Protection Agency, U.S. Occupational Safety and Health Administration, U.S. Food and Drug Administration, or U.S. Department of Transportation. You can pick 3 of the above. All right, strong showing for C. And that is correct. Go to the next slide and look at the correct answer. So in this one, the federal agencies with public regulations pertaining to infection and medical or regulated waste are the EPA, OSHA, and DOT. So other agencies that also do this would be the Centers for Disease Control and Prevention and the Agency for Toxic Substances and Disease Registry. Number 19. Exposure to contaminated healthcare waste does not necessarily result in infection. The following factors must be present for contaminated waste to be capable of causing infection: dose and host susceptibility, portal of entry, portal of exit, or presence and virulence of a pathogen. And then choose 3 of the above. Between C and B here. And B is the correct response. So you want, you'll need dose and host susceptibility, a portal of entry, and presence and virulence of a pathogen. That portal of exit, you don't need it to necessarily, you don't need to come out in order to be able to cause that infection in a human, but you do need it to be able to go in. These are all 5 of the following factors that need to be present for infection to occur from waste: dose, host susceptibility, presence of a pathogen, virulence of the pathogen, and again, portal of entry, all in that question. Number 20, Which of the following statements is true regarding the storage of sterilized items in the sterile processing department? Sterilized items should be stored on a shelf with a solid bottom. Sterilized items should be in high traffic areas for easy access. Sterilized items should be stored in a room with positive air pressure. Or sterilized items should be stored that should be 8 to 10 inches from the floor. That'd be very high. 8,010. All right, so choose 3 of the above there again. I apologize for the typos in this PowerPoint. I thought that I had gotten them all. Everybody's going with B, and that is correct. So the sterilized items should be stored on a shelf with a solid bottom. They should be stored in a room with positive air pressure, and they should be stored 8 to 10 inches from the floor. Number 21. Which of the following situations present the greatest risk for the transmission of pathogens via healthcare personnel hands? Unit secretary with artificial nails, environmental services worker with unchipped nail polish, nurse practitioner with artificial nails, or a registered nurse with chipped nail polish. Choose 2 of the above. All right, everybody's going with 3 and 4. That is correct. You guys are killing it today. So the greatest risk would be the nurse practitioner with artificial nails and the registered nurse with chipped nail polish. You have to think they're going to have the most contact with patients, so they can spread it more easily. Also, that chipped nail polish, never good. So going a little more into depth on this, healthcare workers who wear artificial nails are more likely to harbor gram-negative pathogens on their fingertips than are those who have natural nails. This is before and after hand washing. It does make a difference. The chipped nail polish can support growth of larger numbers of organisms on fingernails. Freshly applied nail polish does not increase the number of bacteria involved from periungual skin. And periungual defined is that it's situated or occurring around the fingernail or toenail. I feel like in some of these questions, they use vocabulary that typically wouldn't use, like the one where they're describing a table and they use, I can't even remember the word that they use. So sometimes you just have to know the terminology and what they're discussing in these questions that can kind of trick you up sometimes. Number 22. Which of the following does not meet the requirements for an airborne isolation room? Negative airflow isolation room, negative air pressure relative to the corridor, at least 15 to 20 air exchanges per hour, direct exhaust to the outside, or daily monitoring of air pressure with visual indicators. Your B's, C's, and D's here. Correct response is B. At least 15 to 20 air exchanges per hour. Does not meet the requirements. We should have a little bit more. So different diseases that are transmitted via the airborne route: measles, smallpox, chickenpox, pulmonary TB, avian influenza, and SARS-associated coronavirus. I hope Measles is something that we're dealing with right now in Washington, which is really affecting us and hitting us pretty hard. Airborne infection isolation. Things that you need with that are at least 6 to 12 air exchanges an hour, direct exhaust to the outside. Air pressure should be monitored daily with visual indicators. Those are things like those flutter strips or the smoke tubes that you can put eyes on, and the door should be kept closed. Number 23, according to the CDC, central venous catheters should be replaced every 72 to 96 hours, every 7 days, after 1 month if malfunctioning. All right, most people are going with D if it's malfunctioning, and that is correct. So you don't want to be replacing them unless they have to be for these CVCs. According to the CDC, CVCs including PICCs, hemodialysis catheters, or pulmonary artery catheters should not be routinely removed to prevent catheter-related infection. A guide wire exchange should be used to pre-place a malfunctioning non-tunneled catheter if no evidence of infection is present. Sorry. You basically don't want to be changing these out if you don't need to. That could actually expose them, my personal opinion, to more likely to get infection by putting in a new one. Number 24. The IP has asked to join the antimicrobial stewardship team at his facility. The IP reviews current recommendations and understands that effective strategies to curb antimicrobial resistance include all of the following except formulary restriction, administer antibiotics with overlapping activity, automatic stop orders, or antimicrobial cycling. What? Most people going with B. Oh, oops. Sorry, I hit lock instead of show correct. All right. B, administer antibiotics with overlapping activity. That's definitely a no-no. You're just using antibiotics if you don't need them, that are unnecessary if you're doing that overlapping activity, which can lead to that antimicrobial resistance. So antimicrobial cycling is alternating the use of different classes of antimicrobials to prevent the emergence of resistance so that those bugs can't gain that resistance. Well, only one. Okay. 25. When coordinating an active surveillance culture plan, the IP should incorporate all of the following recommendations from the CDC, except provide additional personnel to obtain cultures and additional laboratory personnel to process the cultures, monitor adherence to standard precautions, provide a mechanism for communicating results to healthcare providers, or measure outcome to evaluate the effectiveness of the ASD program and contact precautions. Right, most people going with A, but actually it is monitor adherence to standard precautions. Let's see if we have a slide on this. Now I'll read you a little bit more out of the book. All right, so this is just going through why these are correct or incorrect. So the correct response, accept. You wanted to do all these other threes. You don't want to monitor adherence to standard precautions. So looking at this, what you actually want to do is monitor adherence to contact precautions to prevent the spread of MDROs to patient. So contact precautions are a targeted intervention where standard precautions is the baseline expectation for all patients. With providing the additional personnel to obtain cultures and additional laboratory personnel to process the cultures, it's ensuring turnaround time for screening results. C is correct with providing a mechanism for communicating results to healthcare providers because you want to give timely feedback so it can affect changes in behavior. The closer you can do something to the point of it occurring and giving feedback, the more likely it is for people to change their behaviors. If you end up giving it way down the road, studies have shown that it's less likely for people to make those changes. And measuring the outcome to evaluate the effectiveness of an ASD program and contact precautions is something that you want to do. Number 26, numerous outbreaks of infections have been attributed to unsafe injection practices. The IP designs an educational program to review safe injection practices with all nursing staff. These practices include using single-dose vials whenever possible and avoiding using multi-dose vials, discard saline bags used for IV flushes for multiple patients after 1 hour, enter medication vials with a new needle and syringe even on the same patient, use needles and syringes for only one patient. And then you can choose 3 of the above. Yeah, so everyone is going with 1, 3, and 4. B, that is definitely correct. So the thing you don't want to do is discard saline bags used for IV flushes for multiple patients after 1 hour. You shouldn't be doing that at all. So unless I'm incorrect, please guys correct me if I'm incorrect on any of these things ever. So I think, let's see if there's anything else here. Okay, so a little bit more here that Patty put on. So for unsafe injection practices, since 1999, over 125,000 patients in the United States have been notified of potential exposure to Hep B virus, Hep C virus, and HIV due to unsafe injection practices. Reusing syringes and reuse of needles resulting in contamination of common source medications or containers can lead to outbreaks. Contaminated fluids are then administered subsequently to the patient. So if you're using those syringes and needles, it's bad. Instances where these things can happen are in drug diversion. We're using insulin pens or lancets, common source IV for IV flushes, combining the last little bits in a single dose vial of expensive medication like propofol. I know in Washington, we obviously just had a very big patient notification because of drug diversion. And I think this is going to start happening more and more as we realize that drug diversion is occurring, and then it's not just an isolated incident, that people do have these issues and patients can be exposed. You know, even if you're a healthcare provider and you know good practice, sometimes when you're addicted, you're not making those good rational decisions. So I think it's just going to come to the forefront more and more as we have it on our radars. I know it's something that we're thinking about in Washington State for sure after our recent notifications that we had to do, and it can be very expensive to do those notifications. So I think, oh, and just a little bit more about safe injection practices. You never want to administer medications from the same syringe to more than one patient, even when the needle is changed. You do not enter a vial with a used syringe or needle ever, even if it's the same patient. Medications packaged as single-use vials must never be used for more than one patient. Medications from MDV should be assigned to a single patient when possible. Never use bags or bottles of IV solutions as a common source of supply for more than one patient. Goes back to the question. And maintain proper infection control practices during the prep and administration of injected medication. Great, so I think we're going to stop there for now. I am actually going to get out of this for 1 second, and I want to read one of the emails that we got from someone who just took the CIC. So you will just hear my voice real quick. Hopefully you guys can still hear me. And I will go over what Patty sent me. I just need to find it real quick. Bear with me 1 second here. Oh, where's 2 seconds here, guys, if I can find it. And does anybody have any questions or issues going on? Please let us know. Again, we didn't realize that not more than 100 people could be actively watching the screen, so that was great feedback. We didn't realize that that was going on. So please let us know if you're having any